I'm so excited to talk today to the Queen of Dental Hygiene about the connection between oral health and mental health. Let me briefly introduce her before I bring her on. Barbara Tritz is a practicing biological dental hygienist in the office of Green City Dental in Edmonds, Washington. She's also the owner of Washington Oral Wellness in Kirkland, Washington, where she practices orofacial myofunctional therapy. She completed her accreditation in biological dental hygiene through the International Academy of Oral Medicine and Toxicology and is laser certified through the Academy of Laser Dentistry. Barbara's passion for all things dental spilled over to creating a blog and then a website, queenofdentalhygiene.net. She loves to share her knowledge and help others find their total body health. She lectures everywhere from local school health classes to professional continuing education courses. In 2019, Barbara received the Hugh Freedy ADHA Master Clinician Award at the annual ADHA conference in Louisville, Kentucky. She loves the warm weather and has found her happy place stand-up paddleboarding on any glorious day in the Great Pacific Northwest. Hi, Barbara. Thank you so much for joining us for this podcast interview today.
Well, thank you for having me. I am so excited to share my passion with you. So this has been fun to put this all together in one place.
I'm super excited to talk to the Queen of Dental Hygiene and talk about mental health related to oral health. And so I know you have a PowerPoint, so I'll go ahead and let you get started, and then we'll come back and have a conversation afterwards.
All right. Well, thank you. And thank you to all your listeners. I'm excited to share with you. Today's talk is about mind your mouth, how the mouth influences the health of the brain. So I am a clinical dental hygienist. I'm a biological hygienist. I work in a biological office in Green City, called Green City Dental in Edmonds, Washington. I'm also a trained myofunctional therapist. So I'm going to go back and forth using my different hats as we talk. And I am so passionate about dental hygiene and oral systemic health that I write a blog website called queenofdentalhygiene.net. And you can contact me at contact@queenofdentalhygiene.net, and I am happy to answer questions. So today's talk, I'm going to connect the mouth back to the body and to the brain. So we'll talk about gingivitis and periodontitis and brain health. We'll talk about the inflammation from tooth decay and how that affects depression. We'll talk about mouth breathing, sleep apnea, and I want to tuck in there information about non-cholinergic drugs, because nobody's talking about this. And then I'll add a little bit of my biological hat and talk about fillings, mercury fillings, and then what I do for treatment, which involves nutrition, and then what I do in the dental office with care, and then we'll wrap it up with goals. So we'll have an action-packed 50 minutes or so. So gum disease, pathogens, and brain health, they are so intimately related. When I clean teeth, and I often see bloody gums. And bloody gums mean infection. So this is a patient of mine. I just saw her recently. You can see the pink here. That is plaque left over from where she missed when she was brushing. And she's pregnant. And you can see, I just did some gentle cleaning and her gums bleed a lot. Now, oftentimes I'll get patients who tell me, well, my gums only bleed when you clean my teeth. It's like, well, you've had infection and inflammation and it affects your whole entire body. So just because it doesn't bleed when you clean your teeth, you're not going where the infection is. If we take the surface area that is infected in the mouth from periodontal disease, it is about the size of the palm of your hand. And so if you washed your hands and your hands bled, you would run to the doctor. The thing about gum disease is that it doesn't hurt until the final stages. And so, this patient, she can brush her teeth and they don't bleed. But when I clean them, obviously you can see a lot of bleeding here. But that bleeding indicates a whole systemic inflammation. The bacteria that's in the mouth does not just stay there. We swallow the bacteria, we inhale the bacteria, and when our gums bleed like that, it's like a screen door, and the bacteria just pop into our bloodstream and they go like a little ping pong ball throughout our body. And so I've got a list here of our oral systemic links. Now, we can't say yet that the infection in the mouth causes these other things like depression, irritable bowel, erectile dysfunction, cardiovascular disease. I've got about 7 or 8 cancers on this list, vascular diseases, kidney disease, respiratory disease, stillbirth diabetes, rheumatoid arthritis. But we know that the bacteria from the mouth create a low-grade chronic systemic inflammation. And I bet in the next 5 years, we will have much more research that connects these as causal. But for now, we can say there's a connection. And the thing is, I know what bacteria is in there because I use a phase contrast microscope. So I take a plaque sample from every single patient who comes to see me for a recare appointment, and I put it on the microscope. And when you see the bad bacteria that lives in there and it correlates with the bleeding that the patient has, then it's motivating to change it. And so what I say is that the phase contrast microscope should be in every hygienist's hands, because when you see it, you can believe it. It's motivating, it's encouraging to the patient. It is so educating, enrolling, fulfilling. It's exciting to see the healing. And then it certainly makes my job much more interesting. And I love going to work because I love helping my patients heal. Because this is what I see in periodontal disease. A healthy mouth does not have spirochetes. You can see these, it looks like snakes wiggling around in here. You can see the amoebas. I've got 2 amoebas on this slide, and they're just oozing across the screen. And see how many bacteria there are. And this is organized, and they're aggressive. And this is what goes in our bloodstream every time we brush our teeth, every time we swallow, every time we inhale. We are getting these pathogens. Doesn't just stay in our mouth, it goes everywhere. And you can see this amoeba just oozing across the screen. Amoebas are like a Trojan horse, and they burrow into the tissue, and they allow the bacteria then to flood in behind them, just like a Trojan horse. And we are flooded with these bad bacteria into the tissue. Up in this upper left-hand corner, you can see the spirochetes just organized and eating probably a dead white blood cell. Because when the blood cells are outside of the body for 3 days, they no longer function as blood cells, and they die, and they become food for the bacteria. So using a microscope really gives me a window into how healthy somebody is. And I can't work without a microscope. It takes 1 minute for these bacteria to reach every part of your body. When you brush your teeth, when you floss your teeth, or when I clean your teeth. And again, here's another slide that I took a video of, and that's a white blood cell, and the spirochetes are organized around it. So we don't want these bacteria in our body. And the thing is, there's research that connects these spirochetes and the spirochete's best friend, Porphyromonas gingivalis, to the brain. And here I've got some research talking about, spirochetes, Porphyromonas gingivalis, and dementia. And research from 2016 and 2019 talking about how these oral bacteria inflame the brain and what they do in the mouth with that bleeding and inflammation, and they do in the brain as well. So these 2 research studies talk about the fact that, well, maybe the brain is making beta amyloids and tau proteins to protect the brain from the toxins that these bacteria leave in the brain. So, there's a definite connection. So when I see bleeding gums, then I know there's inflammation in the body, in the mouth, there's infection, and I call them leaky gums. And then there's also, these bacteria go into the gut. We have leaky gut and leaky brain. So it's all intimately connected. And we can't not talk about the SARS-CoV-2 virus. maybe it doesn't affect the brain, but it does affect our body. And so it's time for us to really step up our oral hygiene, because there is a connection between the periodontal pathogens that I just showed you on that slide, with the spirochetes undulating, organized, and just crazy, and the SARS-CoV-2 virus. And they combine and they create a super infection in the lungs. So oral hygiene and oral health and dental care has never been more important than it is right now. Here's another study from the International Journal of Microbiology that talks about P. gingivalis. Now, P. gingivalis, which I cannot see on my microscope slide, is the keystone pathogen. And we don't need a lot of P. gingivalis he's kind of the linchpin. When he's present, he directs everybody else. So P. gingivalis' best friend is the spirochete, and there are 57 different varieties of spirochetes. And so if I see spirochetes on my microscope screen, I know that there is P. gingivalis present. And what PG does is that it hijacks white blood cells and red blood cells, and it takes them over, and kind of like a taxi, and it gets throughout the whole body. That's how it moves around. And so it can avoid our immune surveillance system. And they have found P. gingivalis in the brain tissue, in the atherosclerotic plaque, and in the heart muscle. So it's time, we addressed how mobile these bacteria are. And another study that talks about cognitive impairment. These bacteria, they have found them in the brain of dementia patients. And so I've just included a lot of research because I want you to know how important this is. There's a hypothesis that has emerged that resident bacterial populations contribute to the development and progression of Alzheimer's disease by causing, again, neuroinflammation. There's that word inflammation again. So what it does in the mouth, it does in the brain. So we've got more and more evidence that is connecting periodontal pathogens to brain health. This study from even long ago, 2011, so 10 years ago, talks about spirochetes were observed in the brain of 90% of dementia, Alzheimer's disease patients. Inflammation is the key. And P. gingivalis, again, another study talks about the fact that they have found it in the cerebral spinal fluid of dementia patients. There's evidence that P. gingivalis and gingipains, which is part of the result of P. gingivalis, plays a central role in Alzheimer's disease. And then more brain health, periodontal disease and depression. So that inflammation, that low-grade chronic inflammation, is part of depression. And we need to look at depression as an inflammatory response. And it's the body's way of trying to heal itself. And then, again, depression causes, periodontal disease and bad breath, causes shame and isolation and loneliness, and then tooth loss and more body image. So gum health is so important. And when you have bleeding gums, you have a low-grade chronic inflammatory process. And even, I've had people tell me, my gums always bleed. It's like, well, then you've always had a gum infection. Even as a child, I see so many children with gum disease. And here we're going to just change the focus a little bit from the gums to the teeth. So I have an X-ray here of a tooth that's had a root canal. And then right at the root tip, you see this little gray area here that should not be there. There is still bacteria at the root of this tooth. Now, the patient doesn't feel this because we've taken the nerve out of the tooth, but there's still bacteria sitting in the body at the nerve of at the apex, what we call the root tip apex of the tooth. And so that inflames the body as well. So it could certainly cause a chronic inflammatory response in the body. There's something called NICOS, which is a neuralgia-inducing cavitational osteonecrosis. So when we have teeth that are extracted, you've gone to the oral surgeon, you've had the tooth removed, and then it heals up. sometimes they leave the periodontal ligament behind. It's kind of like the afterbirth, and they leave that in the bone. And so the body thinks there's still a tooth there, and it heals around it, and all the bacteria that was left over from the tooth is still in the tissue and in the bone, and it can cause, again, inflammation in the body. So dentistry doesn't acknowledge these cavitational osteonecrosis areas, but having seen the lab results from cavitation surgery, I know there's still a lot of bacteria in the mouth. So we've got to address the inflammation. Tooth decay, another source of inflammation. Tooth decay can open the door to serious and potentially life-threatening health problems. And there's more research. I've got 2 different studies here. Connects tooth loss as a result of tooth decay linked to cognitive function. And the more tooth loss you have, the more potential for memory issues. So tooth decay, tooth decay and gum disease, the infection from both of them, it's an infection. And whether it's a little infection or a big infection, it's kind of like being a little bit pregnant or a lot of pregnant. We're still pregnant. And so there's still infection, whether it's from tooth decay or gum disease. And these infections enhance brain inflammation. So when you have something like this with all this tooth decay, this is very troubling and very worrying. When I look at this person and they brush really well, so it's not an oral hygiene thing, but it's a medication thing. Maybe it's a drug thing. It's a dry mouth thing. I see foamy saliva here. I see wear, so I know that's an airway thing. So there's so many other factors that play into this. And one more recent study, this just came out the beginning of July, that from the Journal of Post-Acute and Long-Term Care Medicine. So it's not even a dental journal, but there's moderate quality evidence suggesting tooth loss was independently associated with cognitive impairment and dementia. And the more teeth lost, the more cognitive dementia occurs. So we've got to get, dentures in there that may reduce the progression of cognitive decline, because I think it's also related to airway. When you take teeth out and you lose that, then the mouth collapses and we aren't getting as much oxygen to the brain. So, which leads us to my myofunctional therapy hat. Sleep apnea, sleep disordered breathing, and brain health are all connected. And the sad thing is, there are 1 billion people worldwide with severe sleep apnea, and they don't know it. So throw in the people who do know they have sleep apnea, the people who have other sleep breathing disorders like upper airway resistance syndrome, like sleep maintenance insomnia, like narcolepsy. And I'm sure there are other sleep breathing disorders that I'm not even aware of. But we've got a lot of people that cannot breathe properly when they're sleeping. And the human jaw is shrinking faster than evolution would dictate. So we have like a good 70% of our young people have braces because they don't have enough room in their mouth for nice straight teeth. And that is, part of our diet, part of our breathing, and genetics, who knows? There's a lot going down. The Journal of Neuroimaging, published in 2015, talks about the fact that sleep apnea contributes to the breakdown of the blood-brain barrier. So those spirochetes that should not be in the brain cross that blood-brain barrier, kind of like a screen door, because of sleep apnea. So the brain should be resistant to those spirochetes. But because of sleep apnea and this breakdown of breathing and oxygen, those bacteria just dance right across into the brain. And sleep apnea, so many docs say, well, your child will outgrow it. They'll grow, they'll be fine. Don't worry about them not breathing or snoring at night. But research study shows that untreated sleep apnea in children is tied to brain cell damage. We need to get our kids breathing at night, right from the get-go. Children should not snore. Children should sleep deeply. They should not have any sleep breathing or issues. If they do, we are killing brain cells. Dr. Karen Bonnick did a huge study that was published in 2012 that she studied 11,000 children, followed them for 6 years. And what she found was especially these young babies that grew to young children, these young children had sleep disordered breathing, and they were prone to developing behavioral difficulties such as ADD, ADHD, aggressiveness, as well as emotional symptoms and difficulty with peer relationships. So this is the largest and most comprehensive study of its kind, and it just reconfirms how important dealing with snoring and sleep apnea are. Mouth breathing, bottom line, is unhealthy breathing, and it contributes to anxiety, depression, fatigue, and facial undevelopment, and it's all connected. So even if your mouth is open just a little bit, like the gal in this photo who's sleeping, she is mouth breathing all night, and mouth breathing is unhealthy breathing. So one of the things I do as a myofunctional therapist is I teach my patients how to breathe through their nose, how to use their nose. And Patrick McGowan writes a blog called buteycoclinic.com, and he has lots and lots of great information on there about breathing exercises and how to calm your breathing. So I encourage you to go to buteycoclinic.com and look at this further. Some things you can do to calm yourself is to switch to nasal breathing 24/7. Stop sighing, and you can, if you notice that a sigh is on the way, swallow it. If the sigh sleeps out, compensate by exhaling through your nose, holding your breath, and shake your head, and hold your breath for 5 to 10 seconds after the exhale. And then Patrick also talks about a breath hold walk. So there's lots you can do to calm your breathing and slow it down. Because if we don't, then we create anxiety and panic attacks, and our kids don't grow properly. We need to help our children grow to their full genetic potential. So we have Napoleon Dynamite here on the left, and you can see, he has an underdeveloped chin, he has a flat face, he looks tired. There's bags under his eyes. He looks like he could go off and take a nap. And he's got his mouth open. So when I see mouth open, I know that there's gum disease. I know there's tooth decay. And I know this person is not healthy. Proper breathing is nasal breathing. And mouth breathers will never, ever be healthy. And so one of my favorite shows is Outlander. And so we have Jamie from Outlander on the left, and you can see his nice strong jaw. He's got a nice handsome face, because healthy faces are handsome. They are developed properly in the proper proportions. And Jamie looks vibrant, he has energy, and he's got his lips together. And that's what I want for my patients. And for the last year and a half, we've been wearing masks, and masks encourage mouth breathing. So really pay attention, if you still have to wear a mask, to keep your lips together and breathe through your nose. Tooth decay and gum disease are a result of mouth breathing, and those are, mouth breathing is a myofunctional disorder. So I want to help our kids grow to be healthy, good adults. Part of that is the food we're feeding them, and the food we're not feeding them. So when we give them baby food, when we give infants and toddlers baby food, I call it slurpy food. It's mushy. They don't have to chew. They don't stimulate their salivary glands. They don't grow their jaws. And we're going to talk about this just a little bit more in just a second. And baby food, baby formula. We've got to get our mamas breastfeeding, because that grows the jaw, that sets the child up for a healthy life and a healthy brain. But when we feed them formula, unfortunately, the first ingredient in formula is corn syrup. And then the fourth ingredient is sugar. So we're setting them up for diabetes and obesity and inflammation. Sugar causes inflammation in the body. So I encourage my mamas to breastfeed for at least a year, if not 2 or longer. It's really important, because we need to have healthy children. And one of the things with mouth breathing is that we don't create nitric oxide. Nitric oxide is made in the paranasal sinuses, in our nose, and it is with the food we eat. And when we have a good level of nitric oxide, it opens up the blood vessels. It kills bacteria. It kills viruses. And viruses, especially these days, is really important to, we want to kill the bad bugs, the bad viruses. And nitric oxide kills SARS-CoV-2. So if we're not breathing through our nose, we breathe through our mouth, all these viruses and grasses and pollens and dander and allergens go straight to our lungs. So nitric oxide, if we don't have a good level of nitric oxide, we will not be healthy. So we need nitric oxide. Nitric oxide is a vasodilator. So if you have high blood pressure, again, we need nitric oxide. If we don't have nitric oxide, then we don't get the blood flow to the brain, and it increases inflammation and oxidative stress, and it contributes to a variety of cognitive issues. If we don't have oxygen in the brain, we don't get nutrients to the brain. We don't get glucose, and glucose is what feeds our brain. So we need to have nitric oxide. And then that blood flow, that cerebral spinal fluid, removes the cellular waste, kind of like the garbage man coming in every night and taking out those beta amyloids and those bad bacteria that are in the brain. So we need to improve our blood flow, and that's where nitric oxide comes in. No nitric oxide, you're not healthy. Now, mouth breathing, hyperventilation, and anxiety. So when we don't breathe properly, when we are mouth breathing, we hyperventilate, and that hyperventilation gives off too much carbon dioxide. We need carbon dioxide to put the right amount of oxygen in our brain. So when we mouth breathe, we give off too much carbon dioxide. So again, if we don't have the right amount of oxygen in our body, it doesn't get oxygen to our brain. And then that triggers an anxiety attack. That triggers more overbreathing, more hyperventilation. And so many kids have anxiety disorders. And when I look at, medical histories, I see a lot of anxiety medications. And then anxiety medication side effect is dry mouth. So it's a vicious cycle. So bottom line, nasal breathing is healthy breathing. And as I tell all my patients, especially my littles, your nose is for breathing and your mouth is for eating. And we shouldn't confuse the two. So breathe through your nose. And if you can't breathe through your nose, then it's time to go see an ear, nose, and throat doc or an allergy doc and address your nasal breathing issues. Now, sleep apnea. Again, breathing. We need to breathe. And I have a photo here on the right. You can see this gal's tongue. It looks like somebody took pinking shears to it. And because her tongue doesn't fit in her mouth. She's got nice straight teeth, so my suspicion is the orthodontist pulled everything in and made her mouth too small. So her tongue doesn't fit on the roof of her mouth. And instead, when she sleeps, because the tongue doesn't fit up there, it falls into her airway. And so sleep apnea is a breathing problem. And you start to fall asleep and your tongue goes in your airway because gravity pulls it backwards. And then you wake up. And so you never get out of that stage 1, stage 2 sleep. It's our stage 3 sleep and our REM sleep, stage 4 sleep. That's where we heal. That's where we take the short-term memories and put them into long-term storage. We need that REM sleep. And if you only ever get into stage 1 and stage 2 sleep because you keep waking up with microarousals all night, then it damages your brain cells again. Just like what I talked about earlier with the kiddos. We need to have good sleep. Sleep is when we heal. So if we don't get 7 hours of sleep a night and we don't get into that deep, restful sleep, we risk cognitive impairment. And snoring. Snoring is just strangling from the inside. So you may not have sleep apnea, But snoring means that there is, again, an airway breathing problem and the tongue is blocking the airway. And whether it is in the sinus cavity or in the back of the throat, snoring is not healthy breathing. So kids should never snore, and neither should adults or seniors. And it is, we laugh at, our uncle down the hall or in this chair snoring. It means he's not breathing. And when the tongue doesn't go up on the roof of the mouth, you have an arch that looks like a V shape instead of a nice letter U shape. And then again, there's no room for the tongue. This poor little gal's tongue never, ever visited the roof of her mouth. You can see an indent. It looks almost like her thumb lived up there, though. And the jaw did not grow properly. And when their jaw does not grow properly and we don't have nice room for the tongue, we can guarantee that this child is going to have airway issues that will follow them through adulthood. Anticholinergic drugs. So I'm tucking this in here because nobody is talking about this. So true confessions, when I hit my 40s and I hit menopause, I had sleep maintenance insomnia. And I attributed it to menopause, and I wasn't sleeping well. And so I talked with my doctor about it, and she said, just take Benadryl. Just take Benadryl. That will help you stay asleep, and that's great. And so I did for about 5 years. And then I wore a snore guard, and then I finally got a sleep study. Silly me. And I finally got a CPAP machine, and I stopped using my Benadryl. And then in 2015, this research study came out, and it shook me to my core. Because anticholinergic drugs, which is Tylenol PM, which is Advil PM, which is so many other medications in addition to Benadryl. The research study said that they found that people who use these drugs were more than likely to have developed dementia than those who didn't. So anticholinergic drugs are connected to an increased risk for dementia. And so I am doing everything I can to make sure going forward that I'm breathing, that I am expanding my palate, I am getting oxygen, I have a CPAP machine, and I am working really hard to prevent the dementia that I'm hopeful that I will never have. But nobody's talking about the connection between anticholinergic drugs and dementia. So I encourage all of your listeners to, check and see if they're taking anticholinergic drugs, because there's a whole list of them, a whole host of them. And, there's no warning on Tylenol PM and Advil PM and Benadryl on this connection, that we shouldn't be taking it for 5 years or 10 years. All right, changing my hat over to a biological hygienist again. In my office, we do safe mercury removal because mercury vapor passes, the blood-brain barrier, and it can cause serious damage to the central nervous system. So mercury vapor is dangerous. And here is a video that I'm going to share with you called the smoking tooth. This tooth has been out of the body for over 20 years. It's a mercury filling. And I have permission from the International Academy of Oral Medicine and Toxicology to share this video with you. They just rubbed the tooth, and they have it under a special UV light, and you can see the smoke coming off of this tooth. Well, that smoke is actually mercury vapor. And so every time they rub it, you can see more vapors coming off. And mercury vapor is dangerous. And this should scare everyone. So in my dental office, we take removing mercury silver fillings very seriously. We call them silver fillings, but in actuality, they are mercury fillings because they are 50% mercury. And mercury is connected to Alzheimer's dementia, multiple sclerosis, ALS, Parkinson's disease. And here again is my research that connects the two from 2014. So this is not even new research. This is what we do in a biological dental office. We take mercury removal very seriously for both the patient and the practitioners, because dentists and dental assistants and the rest of the office as well is just getting a full dose of this mercury vapor. And there are too many dentists that I know that have neurological damage, that have Parkinson's disease. And we want to be safe both for the practitioner and for the patient. And this is how we cover our patients. And we have an exhaust right here to suck up those mercury vapors. And we take this very, very, very seriously. If you broke a thermometer in a school, that amount of mercury would require a hazmat unit to come in and in full hazmat gear. And the amount of mercury that's in a silver filling or in a mouth of silver fillings is just as dangerous. All right, nutrition. Let's get to the preventive part. So every time you eat or drink, you're either feeding disease or fighting it. So I want to fight disease. I don't want to feed the bad bacteria. But sadly, our standard American diet, which is full of chemicals and refined and processed foods and sugar, a lot of sugar, and is not a healthy diet. And it feeds disease. So I want to grow our patients and have them be healthy. So I recommend to my patients to eat the rainbow. I want food that looks like food. I want it low or no sugar. For the last year, I have eliminated sugar in my life, and I feel so much better. And I eat very few carbohydrates, and I stay with complex carbohydrates. I eat a plant-based diet. I eat meat that, I'm not a vegetarian. You need meat. You need the fat from meat in order to digest fat-soluble vitamins. I want to feed the good bacteria with fibers and fermented foods and prebiotic foods. And then for our little people, we need breast milk. That is the best food for babies. And again, I told you I'd talk more about chewing. That chewing action grows the airway. So this makes my heart break. Babies should have real food. If they have 2 teeth, they can chew. We need to give them food that they can chew, so we stimulate the jaw to grow, to use those digestive enzymes. Let's make nice, strong bones in the face and in the jaws. And chewing keeps the teeth healthy and clean. This food does not enhance that at all. We need those salivary enzymes for digestion to prevent constipation. When you don't chew, when you only chew like 6 times and you gulp it down and you've got chunks of food in your gut, you can't digest that. So I want a healthy body, a healthy brain, and a healthy mouth. So what I do in my dental world is a biological dental office. Number 1, I recommend finding a biological dental office. The International Academy of Oral Medicine and Toxicology, the IAOMT.org, has lists of dentists that have taken this extra training, the extra care that is really needed to grow an airway, to use safe mercury removal, to look at the toxins that are in our dental world. And they're IAOMT dentists throughout the world. You just have to do a little searching for them. And as a biological hygienist, I do a lot of salivary testing. I use the phase contrast microscope, and I'm looking at the tooth decay bacteria with carie screening. So I test, I treat, I retest until I have a healthy mouth. If I only did what insurance covered, my patients would never be healthy. So as much as I want to, take into consideration insurance, do you want to be healthy, or do you want to only do what insurance covers? And, I want you to be healthy. So we test, we treat, we retest. I send the patients to nutritionists because I want to feed the good bacteria. I don't want to just wipe out all the bad bacteria. I want good bacteria to thrive, because we can't get rid of the bacteria. We have to work with the bacteria. And there are also good viruses in that microbiome. So we want to reduce the pathological plaque. Tools that I recommend, definitely electric toothbrush, the best one you can afford. Oral irrigation, like a water pick or a hydrofloss. I want to clean in between the teeth. Flossing, most people don't like to floss, but there are other tools like interproximal brushes that would work well as the oral irrigation. And then finding a healthy toothpaste to, fix the problem that occurs. The over-the-counter toothpaste, some of them are just full of chemicals. So I want particular toothpaste to remineralize teeth and kill the bad bacteria and feed the good bacteria. I want to see my patients every 3 months. Every 6 months is too long if you have periodontal disease or tooth decay. So I want my patients healthy between appointments. I use gum therapy a lot. I use laser. I'm laser certified. I use ozone therapy. I use phase contrast microscopy on every single patient because I want to know every single appointment how healthy my patients are. I teach my patients nasal breathing 24/7, how to clear their nose, how to use their nose. Nasal hygiene is as important as oral hygiene. I work with primary care docs. I want to know their blood work. I want to know how healthy their gut is. Leaky gut is the gut is the root of the immune system. So if the gut health is not good, then nothing else is going to be healthy. We need to look at allergies. We need to look at food sensitivities. And then again, I've got food on here again. Work with a functional nutritionist because we have to feed the good bacteria. So this is a sample of salivary diagnostic tests, and this is actually my test from a lab that I use locally. I want to, the mouth is not sterile, and my pathogens, well, I could do a little better. And it gives me a composite score of 2.87. So it's not a bad score, but I know I can do better even for myself. And so having this written out just motivates me to do even more. But I can do periopathogens, tooth decay pathogens, viruses, bad breath pathogens, fungus, genetics, and then more viruses, because I want to know what's going on. So this is a really good complement to my phase contrast microscopy. I work with other docs. Dentistry should not be working in a silo. If you have gum disease, if you have tooth decay, if you can't breathe through your nose, if you're not eating right, we need to work as a group with your primary care physician, a functional medicine doc, functional nutritionist, myofunctional therapist to learn how to breathe and put your tongue in the right place, swallow, chew, all the things that you think we should do naturally take a little bit of work, actually. And then working with a biological dental office. This is some of the blood work that I recommend because, I need to know what's going on in the whole body. And then also a sleep study. And I want my patients healthy. And this is a slide of a healthy mouth. You can see, how different this is from the slide that I showed you in the beginning. There's plaque. There's always going to be plaque. But I want healthy plaque. And you can see that there is no movement in here. Look at how quiet this is. That's what I want. Once I get a slide like this, then you can go to 6-month recare. So mind your mouth because it all affects your whole body and especially your brain. So find a fabulous biological dental hygienist and see them regularly. Address inflammation and disease in the mouth. Do salivary and diagnostic testing for gum disease and tooth decay pathogens. We need to know and then test, retest until it's healthy. Nasal breathing 24/7. If you don't know how to do that, work with a myofunctional therapist and then go see an ENT or an allergist. Work with your primary care docs. Let them know that you have gum disease and tooth decay and let them help you find the source of the inflammation. Is it a vitamin D deficiency? Is it a iron deficiency? What's going on that is allowing the immune system to break down so much that you cannot fight the bacteria in your mouth? Get a sleep study, address those airway issues. Have a healthy diet, eliminate sugar. Definitely chew your food thoroughly. Your food should be soupy when you swallow it. You shouldn't be chunking down your food. And then, of course, exercise daily. My goal, healthy mouth, healthy body, healthy brain. I want clean teeth. I want nice tight gums, nice U-shaped, and no bad breath, no bleeding. That's the goal, is a healthy mouth so that you're breathing properly and you have a healthy brain.
That was amazing. My
Oh,
goodness.
thank you. Thank you.
I learned so much and I'm freaked out a little bit, actually.
Okay, well, then come on up to Edmonds, Washington, and I'll help you have a healthy mouth.
Oh my gosh. Yeah. I mean, I know that a lot of people might be confused as to why am I talking to a dental hygienist, but you've definitely proven that this is not just an isolated part of our body. It connects every part of our body, and including our brain, our heart, our lungs. And I'm just blown away by it all.
Well, good. We have to put the mouth back to the body. For so long we have treated dental hygiene as a cosmetic issue, and it is so not a cosmetic issue. It is a systemic health issue. It is intimately related to our health. These bacteria feed the gut, and then the gut feeds the mouth, and it's just a continuous loop. So if we aren't eating healthy, if we aren't breathing healthy, if we have inflammation in our mouth, it affects our whole body. And
I know you mentioned the connection between just even sleep. If we're not getting the right amount of sleep, it's going to affect us. And I'm so religious about sleep.
good.
But if we're not getting good quality sleep, if we're mouth breathing and we're not getting that deep level of rest and repair type of sleep, it's going to, affect our mental health as well. And I was shocked to find the connection between our oral health and our sleep. So you mentioned that and you clarified, which was great. But I've tried mouth taping just to kind of. I'm normally a nose breather, but sometimes at night I find myself breathing through my mouth, and so taping my mouth has helped. Can you say a little bit about mouth taping, because it sounds really like a torture device?
Actually, I love mouth taping. So this is my myofunctional therapist hat on. So mouth taping it just reminds you to breathe through your nose. Now, there is something called myotape that goes around the lips, so gently reminding you to keep your lips together. So you don't have to tape. So that's one option. And they make myotape for children as well. I wouldn't want to tape anybody younger than 4 or 5. But just when you sleep with your mouth taped, you sleep deeper. You sleep so much deeper, you will wake up refreshed. It's when your mouth is open, again, you never get to that stage 3, stage 4 sleep. So I use tape. I put little handles on the side, so I just fold it over. So in case I have to sneeze or talk, I can just rip it off. But I would say work with a myofunctional therapist. Don't just nilly-willy tape.
And start taping, yeah.
Yeah. But the myotape, I don't have a problem with people trying that. And it's on Amazon and it's on my blog. You can find it on my blog too. So the deeper you can sleep, the healthier you are.
And I know for a lot of people, they don't even want to sleep. So I know a lot of teenagers and young adults don't even want to go to sleep. They want to stay up all night. They want to, eat junk food, and especially when they were home from school because of the pandemic. And so they might not even care about the sleep part, but I love that you showed Napoleon Dynamite versus Jamie Fraser, how the chiseled jawbone and the good looks because of his nose breathing versus the mouth breathing, where the chin is shorter and your face is imbalanced and symmetrical. So I like that you mentioned that, because if people don't really care about their sleep, maybe they care about their looks, and that would be a good reason to start nose breathing.
Yeah, I mean, if you look at all the character actors on television and the movies, they aren't as attractive, and it's because of the way their face grew. And the leading men and women in movies have a handsome face because it's in proportion. It has grown properly, and we want good-looking people because that means that they're healthy, that they have grown in proper proportions. And when you're mouth breathing, your face doesn't grow properly.
That's true. I did read a book a long time ago called The Dental Diet, and I learned so much about like people in poor villages in Africa that actually eat real food. They don't have a processed food diet. Their jaws develop perfectly well, and then they don't have a lot of cavities. They don't need braces. But like you said, human jaws are shrinking, and our kids are getting braces more than ever. Can you say a little bit about that in addition to like what I just said?
Absolutely. So Dr. Stephen Lin wrote The Dental Diet, and he is one of my heroes. And his website is outstanding. That's where I go for more information on what to recommend to patients. Dr. Weston Price was his inspiration. And Dr. Price went around the world to 14 different isolated communities and did exactly what you said. He studied those people, and he evaluated what they ate and how they breathed and the nutrients that they ate. And they all had room for 32 beautiful, healthy teeth. And then he went to nearby civilized communities and photographed them and counted those cavities. And those mouths were just breaking down. And so food is really important, good nutrition and sugar. One of the things that sugar does, it's not what we think, eating a candy bar and you get a cavity. It's the sugar that inflames the immune system, that causes leaky gut, that stops the interstitial fluid flow within the tooth. Your tooth is like a tree with sap. And when we eat sugar, that stops that fluid flow within the tooth. And now we get the acids coming into the mouth and into the teeth, and that's where tooth decay starts. So, diet is so important. Food is medicine, and getting a good, healthy diet, which is why it's so important in my dental world. And I love that you read The Dental Diet. I've read it twice, and it is my Bible, because I want my patients to be healthy. And it's not just about brushing. Tooth brushing and flossing is probably 25% of dental disease. Another 25% is the mouth breathing, tongue rest posture. And another 25% is the food we eat. And then another 25% is our gut health. So it is, in order for total systemic health, we have to address all the pillars of health, and being aware of that is vital.
I wish I knew about the importance of diet and mouth breathing and nose breathing with my child, because I mean, I didn't grow up here when I was younger. And so my mom has always forced us to eat healthy. I'm sure I was always a nose breather. And so I never needed braces. And I didn't have a lot of issues with cavities growing up until I went to college. And then I started using the American diet and eating more junk and processed foods and not eating the meat, like you said, and eating more simple carbs. That's when I started getting cavities. And now my daughter needs braces. And it just saddens me that she has to go through that, because it could have been avoided if we were proactive.
Exactly. But nobody knows about this. This is why I'm on a mission to share this. And I so thank you for inviting me here. This is nobody's talking about this. We're just drilling and filling and scraping and polishing, and see you in 6 months, and then we do it all over again. And people are surprised when they have new cavities every time, and they just expect that their kids are going to have braces. It's just standard.
And it shocks me that they don't want to pay extra for somebody like you to be preventative, when I have patients that are in their 50s, 60s, and 70s talking about spending $30,000, $40,000, $50,000 on oral restoration when they're older. But they don't want to spend the extra money to be preventive and learn the right ways to treat their mouth and take care of their teeth.
Yeah.
Surprising.
I know. It is sad, but the patients that find us, that want us, they go the extra mile to find a biological dental office, and it is worth the time and the money. So I encourage people to dig a little deeper and find the root cause of dental diseases and what's going on in the mouth. And it may not be in the mouth.
Right. One thing that you said that kind of scared me, because I recently removed all my amalgams, but not with a biological dentist. And they didn't take care the way you were mentioning. And I was like, do I have brain damage now? What should I expect with those mercury vapors?
Well, I would actually talk with your naturopath and see what, you do some heavy metal testing and see what needs to be done to help your body get rid of the mercury that's still in your system. Some people can process mercury out, some people can't. So that's more for a naturopath to tell you than I do. But from moving forward, now how important it is. And I wish I knew, what else to tell you to do. That I would send you to your naturopath.
Well, that day I did take 2 charcoal tablets, and then I've been
good.
sweating it out in my sauna, and I'm hoping that does something. So I don't know.
Well, good. You're already proactive, so that's a good thing. But heavy metal testing, that would be where I would send you to take, a little deeper dive and see what else you need to do to chelate and get those heavy metals out. So
that sounds like a good idea. I do have a question that one of my patients brought up. I don't know if you know anything about dream interpretation, but he keeps having these dreams of every time he's stressed out that he's pulling his teeth out. Have you ever heard that, where people have these
all
dreams?
the time. Yeah.
Really?
What I would wonder is he clenching and grinding while he's sleeping? And I would say get a sleep study. That would be my guess. Is let's see how healthy he's breathing at night, and we have sleep studies that we send home with our patients in the office, and we only charge less than $300 for that sleep study. It's a take-home study, and then the patient brings it back to us, and then when we send it to a sleep medicine doctor for a diagnosis. So it's not horribly cost prohibitive, but the in-office sleep studies are certainly way more costly, but you get more information too.
Right.
So I would wonder if he isn't clenching and grinding.
I'll definitely take that back to him. And then, are there any supplements or specific foods that you would recommend for healthier teeth and gums?
Oh, lots and lots. Vitamin K2, vitamin D3, they work together. So you need to take them in the proper dosages so they work together. Vitamin K2 tells the calcium in the blood where to go. So if you have tartar buildup, it means that you don't have enough vitamin K2. And we need fat-soluble vitamins, vitamin A, vitamin D3, vitamin E, vitamin K2, in order to feed the odontoblasts. And so we need meat and the fat from meat in order to digest those fat-soluble vitamins. If you have active tooth decay, you are probably short of one of those or all of those fat-soluble vitamins. So, that's where the blood work comes in, testing for that. Vitamin C for bleeding gums, and not just ascorbic acid, but the whole vitamin C. And, foods with vitamin C, jicama and broccoli and oranges, really whole vitamin C. Nitric oxide foods, so leafy greens, which is one of the things that I have added to my diet. I eat spinach or arugula or kale with my eggs every morning. And I have a leafy greens at night as well. And then I'm supplementing with beet powder, super beets, because, that nitric oxide level, when I did my test strip a year ago at the beginning of COVID, my COVID staycation, I was low. Oh my gosh. I thought I was healthier than I was. And so ever since then, I have really upped my nitric oxide, because without nitric oxide, you cannot heal. And especially now, I want my immune system I want it on because I want to be able to fight those viruses that I come in contact with. And, in my dental world, my face is right in the patient's face, and I am getting aerosol and I'm suctioning, but there's still, a lot of aerosol going on and a lot of these pathogens. I always have my patients do a pre-procedural swoosh with ozone water so that we're lowering that bacterial load and the viral load. But I'm still getting a face full of aerosol. And, face masks don't work. Okay. I mean, the virus is so small and the mask, the pores on the mask is so big. I heard a physician equate it to throwing sand at a chain link fence. And that's as effective as a face mask is. If I'm wearing a face mask, I can still smell onions on somebody's breath. I can still smell perfume through there. So I know that, the face mask is not stopping anything. So I want everything that I can do for my immune system to be nice and strong. And that's where, nitric oxide, vitamin D3, vitamin K2, and having a good, healthy diet with whole foods that look like foods and no sugar. Eliminate sugar, eliminate anything in a box, eliminate anything that you can't pronounce.
Yeah, that sounds really good. You had mentioned healthy toothpaste and
Yes.
oral cleaning stuff. So can you share where we can get some or recommend some healthy toothpaste or healthy dental hygiene cleaning products?
Well, so on my blog, I have a list of all my favorite things. And I have a tooth decay treatment plan on there as well. I mean, I'm trying to have everything in one place for people. My favorite toothpastes don't have fluoride in them. Fluoride is a neurotoxin, and fluoride does not work. I know that the dental community bows to the gods of fluoride, and unfortunately, fluoride is a neurotoxin. It does more damage to our bodies than it does good. And I've written a blog post on it titled "Leaving the Land of Fluoride." And it's, even for hygienists, for me to leave fluoride is really difficult. I've been told how wonderful fluoride is, and fluoride is actually really destructive. And so what I want is a toothpaste that is as natural as possible and remineralizes. So for my patients that have tooth decay, I like Boca toothpaste, B-O-K-A. I like Risewell. And both of those have nanohydroxy crystals in them to remineralize the tooth. For my periodontal patients, I like Dentalcidin and Dentalcidin LS because it is a biobotanical. It is as natural as I can get, and it kills the bad bacteria, doesn't kill the good bacteria. And then I like baking soda, common sense teeth powder. That has xylitol in it, that has remineralizing agents, and it has a neutral pH, and it's a baking soda base. So, I want a pH of 7 or higher. I want the mouth to be neutral or alkaline, slightly alkaline, because these decay bacteria and tooth decay and gum disease are acidic-loving anaerobes. They like an acidic environment. So when you get like Listerine in there, Listerine has a pH of like 3.5 to 4.5, keeps the mouth really acidic. And the bad bacteria go, whoa, this is a party. So I want to get the pH up. I want to keep the mouth neutral. And then we won't have that bad bacteria thriving. And just plain old baking soda out of the box. And I mix baking soda with some coconut oil. And there's a remineralizing product out there now that is just that I love. It's called Biosol. And Biosol is just a little tiny packet of calcium and phosphate. So I have patients mix their own toothpaste. You don't have to have commercial toothpaste. A little bit of ozone oil, a little bit of baking soda, a little bit of coconut oil, and throw in a packet of Biosol. You've got a great toothpaste. And then put a little, essential oil that you like the taste of in there, and off you go. You got your own toothpaste. So, and salt water, just rinsing with salt water and gargling, cleaning your tongue, brushing the roof of your mouth, and getting all of that plaque biofilm out of there. All good.
For somebody that loves to do it yourself and make my own stuff, I'm so excited about that. I can't wait to go make that.
Oh, good. Yeah. It's, we don't need commercial toothpaste.
Yeah, it's true. So knowing what you know now about everything that you've studied and seen and those slides that you've watched, what would you tell your younger self about oral care?
Oh, how very important it is. That we shouldn't be beholden to insurance, because if you only do what insurance covers, you'll never be healthy. And to be really much more proactive, let's grow the airway, especially for our youngest little people. Get the thumb out of there, get the binky out of there. Let's get breastfeeding, really push that, because a bottle and a sippy cup, those are bad things for facial development. And to be much more proactive for our little people so that they grow and have a healthy mouth as adults, and not to accept tooth decay and not to accept bleeding gums, and be aggressive. A little bit of infection is the same as a lot of infection. And I look back and think, well, I allowed that patient to go home for 6 months with bloody gums because they didn't want to pay. It's like, I wish that we had been more proactive.
Well, I think with physical health in general, you either pay the farmer or you pay the doctor, right? And so a lot of people would rather use their insurance to pay the doctor, not realizing how much long-term damage they're doing and how much their health is going to cost them down the road. And it's the same thing with mental health. I always want them to be proactive, because everything you just said about our oral health, we need to do for our mental health in general, even if we're not talking about the connection, because when we're eating well, when our gut bacteria is balanced, when we're getting enough sleep and resting and repairing, we're not so anxious, we're not so depressed, we're not so, we don't have issues with ADHD and concentration and brain fog. It's all connected.
It is all connected. And we have to look at the whole picture. You're right. And if we aren't healthy, our immune system is taxed, then it's like dominoes. It just spirals down and to chronic disease. And chronic disease starts when we're young, the building blocks for that. So breathing and chewing and eating right, and paying attention. I want to live to be a healthy 100. That's my goal. And
Betty White, that's my goal.
Yay. Good.
Be like Betty White, be in your 90s and still work and be happy and have a good sense of humor and not being pushed in a wheelchair. Or
exactly. And have it all your brain. Cognitive decline is scary.
It's optional.
Yeah, it is. It is. Yeah. Dementia is like 80% preventable.
Yes.
So but we have to pay attention and start now.
Do the work, commit to it, definitely. Yes. So thank you so much for taking the time and being here and having this conversation. I'm just as passionate about it as you are, because ever since I've read that book, The Dental Diet, it woke me up to things that I didn't know before.
Good.
So
excellent.
I'm glad I found you.
Many more books on my blog for your reading pleasure. So
I will definitely put all your information in the show notes. And can you remind us again where people can find you?
So my email address is contact@queenofdentalhygiene.net. My blog is queenofdentalhygiene.net. And I thank you for listening. And I am so excited to share this with you.
Well, you're a gem. Thank you so much for all that you do and for educating the community and sharing your knowledge and awareness and putting this educational PowerPoint together for us today and teaching us about the connection between oral health and mental health. I so appreciate that.
Well, thank you. I appreciate your asking. It is so important. So I thank you.
Definitely. Wasn't Barbara awesome? That was such a wonderful discussion about the connection between oral health and mental health. So now we'd actually love to hear from you. I'm curious, out of everything you just heard, what was your takeaway? What was your aha moment from this interview? What are some key takeaways that you're going to take away with you and apply to your life? Share your comments below or visit transforminganxiety.com/podcast and leave me a comment there. Until next time, keep prioritizing your mental health as you create the life you love. Thank you so much for tuning in, and I'll catch you next time.